Okay, good morning and good afternoon, colleagues. I hope you can hear me loud and clear. Maybe just a quick sound test with Christina online. Can you hear me well?
Yes, loud and clear.
Brilliant. Thank you, Christina. And it's great to see a few colleagues online with their videos on, including a number of our panelists. So perhaps we can get started. We have quite an important and crucial topic that we are covering today. Once again, good morning and good afternoon, and many thanks for joining us today for this IASC thematic briefing on the impact of COVID-19 on women and girls. My name is Mervet Shelbaya, and I'm the head of the IASC Secretariat, and it is indeed my pleasure to be moderating today's session. Now, we're all very much aware, and more we're getting exposed to the multifaceted impact of the COVID-19 pandemic, not only in terms of the direct health implications on the most vulnerable populations in the world, but also the socioeconomic implications, the strain it is placing on the provision of health, basic health care and services, such as sexual and reproductive health, the rise in protection concerns, including with reports and very alarming reports of the increased incidence of gender-based violence. And according to UNFPA estimates, there are an additional 15 million cases of gender-based violence that are expected worldwide for every 3 months that the COVID-19 lockdown continues. Not to also underestimate also the mental health concerns, including with women often taking on additional psychological and physical burdens as caregivers. As such, it is very clear that the pandemic is having a disproportionate effect on women and girls, and there's considerable work that's happening at the level of the IASC or under the auspices of the Interagency Standing Committee, as well as partners, to look into these issues and look precisely and more specifically at what can be done to address some of these growing concerns and ensure the required support to our colleagues in the field. So today's session is really an opportunity to shed light on how the COVID-19 pandemic is further exacerbating gender vulnerabilities. And it's also an opportunity to hear and share some of the good practices and the tools that are available to address such vulnerabilities. We do have a great panel today to speak to us on this issue. And I'm pleased to first introduce you to two colleagues that are joining us from Bangladesh and Lebanon, who will speak to us on how gender vulnerabilities have been exacerbated as a result of the COVID-19 and what are we doing about it on the ground, some of the good practices and lessons learned. So starting off perhaps by introducing Ms. Razia Sultana, and she is a Rohingya human rights lawyer and executive director of the Rohingya Women Welfare Society in Cox's Bazar in Bangladesh. She is a key member of the Rohingya diaspora peace movement, and she has been extremely active also including in presenting or representing the Rohingya community at the UN Security Council Open Debate on Sexual Violence in Conflict and at the International Court of Justice hearings. We're also joined by Ms. Joanne Kramesti, and she is a gender advisor with Oxfam in Lebanon. And she's been working on GBV issues for the past 7 years in Lebanon, mostly with the International Rescue Committee. And we're also very, very happy to be joined by the co-chairs of the IASC's, the Interagency Standing Committee's Reference Group on Gender and Humanitarian Action, who will speak to us about efforts at the global and field level to address gender vulnerabilities and the empowerment of women and girls, particularly in light of the COVID response. The two co-chairs are Ms. April Pham, and who is the Senior Gender Advisor and the head of the Gender Unit in OCHA. She has over 25 years of experience in women's rights, gender equality, and the prevention of violence against women and children. And for the past 10 years, she's worked in humanitarian action, including an interagency gender advisor with humanitarian country teams in Sudan, South Sudan, Yemen, Ukraine, Myanmar, and other contexts. We're also joined, the second co-chair for the IASC Reference Group is Ms. Julie Lafernière, who is the Senior Gender Lead for Oxfam's Global Humanitarian Team. She's a lawyer by training and has worked on human rights and women's rights in Canada and internationally, with a focus on GBV in humanitarian settings. So again, welcome to all of our panelists. Thank you for joining us today, and a warm welcome for also the participants, the colleagues that were able to join us today for this webinar. As with usual practice, we will kickstart with presentations from our panelists, but I would also invite you as soon as possible to also post your questions, your comments in the chat box, and my brilliant colleague Christina Powell, who's also online, will be monitoring the chat box and will make sure that we address the questions as relevant to the various panelists. So perhaps maybe we can start with April and Julie, our co-chairs for the IASC Reference Group on Gender and Humanitarian Action. Perhaps maybe we can start with a specific question to you. It would be great to hear your thoughts on how gender vulnerabilities have been exacerbated as a result of the COVID-19 pandemic. And what are we doing at the global and field levels to address these serious concerns, including perhaps also sharing some of the practical tools and guidance that have been developed to support the response and ensure that the response is a lot more gender sensitive as we proceed. So perhaps maybe with that, I'll turn over to April. Perhaps April, we can get started with you.
Thank you very much for the
If I may say, there's a little bit of background noise, so colleagues, please do put your phones on mute. Thank you.
It's an absolute pleasure to join the conversation this morning, afternoon. Welcome, colleagues. If I can just start by saying I cannot underscore the importance and the significance of this briefing, because I think it's important to make sure that we keep women and girls at the center of our humanitarian response, and to keep these issues at both the global level, the regional level, and also in the local responses, to make sure that we are being inclusive, that we are being gender responsive, and that we're not leaving anyone behind. And I think I'm very interested to hear of some of the good practices today, and from all of you online as well. So it's not just about us sharing what we're doing at the Gender Reference Group, but also inviting our leaders, our humanitarian leaders, to also share with us in terms of some of the ways that you've advocated and pushed forward this agenda. I want to just contextualize the conversation of why we're having the conversation around women and girls. I think Mervat started the conversation by saying that we have a lot of protection concerns. We know that gender inequality has been exacerbated during this crisis, but we also want to underscore that these inequalities were pre-existing COVID. So this current pandemic is exacerbating, is making the situation worse for women and girls, and in particular women and girls of multiple vulnerabilities. So we're talking about adolescent girls, we're talking about older women, we're talking about single-headed families, and we're talking about pregnant women, and also women and girls with disabilities. So we're very much wanting to not only talk about gender inequalities, but how it intersects with some of these other factors to further compound those vulnerabilities that Mervat was talking about. Now, I also want to bring in this issue of leadership, because when we talk about gender and we're having this conversation at this global level, it's important to also note that the role of leadership and humanitarian leadership, and for all of those of you who have called in, is absolutely critical. It is not only about the gender advocates pushing for these issues, but it's about the collective action of all of the humanitarian actors in our humanitarian ecosystem that push forward this agenda. So we're talking about, the emergency relief coordinator, who's been a total champion on gender equality, And we're talking about humanitarian coordinators, for example, Mark Kutz, who is, in the Turkey-Syria operation, who constantly promotes the rights and leadership of Syrian women in that operation. So we're talking about a multitude of leadership that is required. But today we're also going to look at leadership in terms of local leadership, women's leadership at the country responses, including our colleagues Razia and Joanne, who will share some of those experiences. Now, I wanted to talk about leadership because I think it's important because that shapes how we do our response. So on to the question around, how are we responding at the global level? Let me just share a couple of things. So first of all, with the Gender Reference Group that is being co-chaired by UN OCHA and Oxfam, Julie and myself, it's not just about the two of us, but we are mobilizing over 30 UN agencies and NGOs, including PLAN, including Concern Worldwide, including CARE, and with UN agencies like UNHCR, UNFPA, and of course, UN Women, who play a critical role in pushing forward some of these issues. So we mobilize the collective action of these organizations at the very onset of the COVID situation to produce this gender alert, which you will all have access to, and we will share it around again if you've not seen that. But it basically, provides this the gender dimensions of what we foresee to be some of the impacts of COVID, what we know from other pandemics and what we know from other humanitarian settings, and also some of the good interventions, some of the good practices that are needed in order to mitigate some of these responses, and in particular mitigate the protection concerns such as GBV, which we know has been totally amplified because of the quarantines and because of their stay-at-home orders in many of our operations. So the Gender Alert, the Gender Reference Group at the global level played a critical role in terms of mobilizing the development of this guidance, but we didn't just stop there. It was also mobilizing the translation of this guidance, but making sure that we were also doing webinars to make sure that they knew how to implement some of the policies. Because I think often, sometimes we develop policy and guidance, and that doesn't get translated into action. I think from last review, we saw that there was like over 500 pieces of guidance and policy and good practice that is floating out there around gender and COVID, right? And I think that's a lot. And so we know what we need to do, but it's about how are we implementing and how are we sharing some of the ways in which we're implementing for impact. So that's so on the gender alert, we did that at the global level. But if I can also say one of the other key ways in which we're trying to make sure that gender issues are better analyzed in terms of gender analysis and utilized to inform the response is through agencies like CARE, who've done the rapid gender analysis, not only at the global level, but also at many of the country contexts in which we work. And that analysis really helps to inform what we do in response to some of these issues that are coming up. I also want to just, take the opportunity to highlight that UN Women also has a data hub, and this data hub is a great tool because it disaggregates data around COVID into sex and age and disability, and it shows us the impact. So, for example, we all know that men are more infected. The infection rates amongst men are slightly higher than for women. But we know that for gender roles, women will burden a lot of the care responsibilities because of their social norms. And so we want to make sure that, we're looking at some of those dynamics as well. And then in terms of some of those dynamics, when you look at the data in the data hub, you will see that even though men are mostly most of the infection rates are male, when it comes to health workers and you disaggregate that, it's actually more female because it is very female dominated in terms of the healthcare profession. 70% of women, etc. So I think it's important to look at, how we use data. And then in terms of guidance, we have UNFPA who've been quite strong in terms of pushing some of the guidance, and in particular on how to minimize and mitigate on gender-based violence. And so right now there's a workshop happening with UNFPA and UNHCR for staff on how to, how to mitigate and how to respond to GBV in our context. And I just want to also talk about the global response plan on COVID. Gender equality and inequalities, and in particular the mitigation of gender-based violence, has been very core to this document, this strategic document. And I think it's important that at the global level, these issues are highlighted, because then that actually translates into informing what humanitarians do at the ground level to respond to some of these issues. But one of the issues that we have, regardless of how much we prioritize at the global level, we are still behind when it comes to funding. So at the moment, we are still lacking funding for GBV and funding overall on gender equality and gender equality programming. So I think it's important, if there are donors online, if I can just do that plug, that a lot of this work is around the need for more funding. So, if I can just encapsulate, the need for leadership, the need for collective action. But I think on the question around tools, absolutely we need tools in order to translate some of these collective policies and actions, into concrete, practical actions on the ground. And so if I can just talk about some of these tools that we have. So we have the Gender Handbook, which is pre-COVID, but a lot of the guidance and a lot of the examples that are shared there still pertain. So it's about how do we engage with women and girls? How do we find ways in which to innovate to make sure that they are engaged in decision making? We have the Gender and Age Marker, which is a tool to design programs, and we totally encouraged all of our humanitarian partners to use that. But I also want to focus on civil society and women's organizations as being one of the most untouched tools and resources that we have. And it's great that we're hearing from Razia today from Cox's Bazar, and we're hearing from Joanne, in Lebanon, in terms of how they're utilizing, women's leadership and access to women and girls to inform some of our programming. Because I think this is one of the tools that we often don't talk about. So I really want to implore us to think about women and girls as being critical resources and critical leaders and responders in the COVID response. But also, that they're not, we often frame these conversations around vulnerabilities. And absolutely, there are multiple vulnerabilities that women and girls are exposed to. We're talking about, living in a society where only 6 countries in the world have equality enshrined in law for men and women, and no countries have actual gender equality. And it's going to be another 100 years before we actually achieve that gender equality. And a recent survey last year, where it showed that 90% of men and women showed some gender bias. And so this is a context in which we operate, in which we work across all communities, across all of the operations that we work in. It's still male-dominated, and it's still sexist, and it's still racist. And I think it's important that we acknowledge some of the parameters within which we work, that we still need more women in leadership positions, and that we need more women in humanitarian decision making. So I wanted to just, make that link between our humanitarian ecosystem and the importance of really ensuring that we engage with women leaders and women responders and utilize them as the most critical resource that we have. And, so I certainly, look forward to hearing from our colleagues around how we do that. And at this point, I want to bring in Julie, who's the co-chair of the Gender Reference Group, to kind of complement some of these issues. And if I can just say, the co-chairs are UN agencies and NGOs, because it recognizes that, we are all implementing and doing this work together. And it is around that collaboration. It is around that collective responsibility. The UN cannot do these responses on its own. It needs its partners, and our partners like Oxfam are very critical. Julie, would you like to come in and complement this before we move to hear more from our field colleagues?
Hi, April. Thank you. Hello, everyone. I'm just going to take just a few minutes, really, because I think April covered it very well, talking about this ecosystem. And just picking up on that, I think that for me, the great thing about this particular webinar and webinars of this kind is that at the global level, we can only be as good as if we understand what's happening at the local level. If we only, so that we can connect what's happening from the local to the global and raising the issues that need to be raised. So I think it's great here that we have two local examples that we'll be able to use, but also please use the chat. Tell us if you, because we've left a lot of space for questions, for discussions, so that we can hear from you, as April said. Because really this ecosystem only works if we're all working together and if we're all understanding really well and trying to understand better and unpack these issues. So I'm just going to leave it there, really. I think that I'd rather hear from you, and I know that April is also very keen to hear from you on this call. Thank you.
Brilliant. Many thanks again, Julie, and a huge thanks as well to April, and I know we're all super anxious to hear from Razia and Joanne. And again, as you've mentioned, Julie, our response is as good as our understanding of the local realities, and the only way to get a better visual of what the local realities are is with more systematic and beefed up and strengthened engagement with the frontline responders, particularly in local NGOs and civil society organizations. So we're looking forward to, again, the interventions from colleagues, but I also heard from you as well, April, very loud and clear that absolutely the issues around gender vulnerabilities have been there prior, of course, to the COVID pandemic. They have been exacerbated as a result of this crisis. So we need to keep that in mind, that it's actually an exacerbation. And thank you also for highlighting the very particular needs and vulnerabilities of specific groups, including adolescents, female-headed households, pregnant, the elderly, the disabled. So really, really important to recognize the importance in that sense also of the data gathering and the data analysis, and the importance of disaggregated data for us to be able to do more in support of local actors to target our support and our interventions. It is a collective responsibility. It is a cross-cutting issue that touches upon every aspect of the response. So thank you for highlighting that. And also thank you for highlighting that the leadership engagement and the commitment from the global level, but also at the local level, is absolutely essential for us to make the required shifts and transformations in this space. So maybe with that, again, the long-awaited, of course, interventions from both Razia and Joanne. And if it's okay with you, Razia, we'll kickstart with you. And here it would be extremely useful to also get a visual from your end in terms of the gender concerns that are faced in Cox's Bazar. And I know that you are addressing the needs of a number of very specific communities, whether it's the Rohingya community, but also the specific needs of women and girls in Cox's Bazar, Bangladeshis in Cox's Bazar. And also, I'm particularly also keen to hear from you in terms of how yourself, as a critical local actor and a woman leader heading a critical civil society in Cox's Bazar, how do you view the collaboration with other humanitarian actors? So curious to see how is this engagement with the UN, with international NGOs and other actors is faring? Is it working well, or what is your advice in terms of us to do more to strengthen this collaboration? So maybe with that, over to you, Razia, please.
Thank you so much giving me the floor. And Assalamu alaikum, good afternoon and good morning, and from Bangladesh, good evening. I'm Razia Sultana, a Rohingya, born in Myanmar and raised in Bangladesh. I belong to the Myanmar minority with a complex identity. My people being stateless and persecuted every day. In April 2018, I spoke before the UN Security Council during its open debate on sexual violence in conflict, and reported about the decades-long sexual violence in conflict, and reported about the decades-long pattern of rape, violence, discrimination, and displacement of Rohingya and other ethnic people in Myanmar. In August 2017, more than 700,000 Rohingya exodus to Cox's Bazar, where we can find today the largest refugee camp in the world. I had to do more, so I founded and now running the NGO RW Welfare Society. So far, Rose is the first and only Rohingya-led, also women-led, registered organization in Bangladesh. As a lawyer, as a teacher, as a Rohingya and a woman, I continue to serve my people and all who are denied of human rights, especially women and girls. A Rohingya woman was not safe in Myanmar. She is still not safe in Bangladesh. Women and girls in the camp, at the same time, those in host community are deprived, discriminated, no voice restricted. Rohingya were denied education for generations. We are branded as uncivilized. People in the camp have very limited space to raise their voices and access information. This is worse for women who are confined mostly in their homes and not allowed to interact. Gender-based violence, including child marriage and trafficking, is high. Trauma from their lives in Myanmar and now in the camp is evident. This is the existing gender situation and now got worse with COVID-19. Women-specific issues like GBV, reproductive health, and psychosocial care are not considered as life-saving. Women are being blamed for spreading of the coronavirus in the camp due to being blamed of dishonorable activities, and their movement outside the home are being further policed and restricted. Our women leaders, our own staff are not allowed to help. We stop our activities. Our center is closed. Women's rights are never a priority during peacetime, during conflicts, inside camp, outside camp, with or without pandemic. Monsoon and cyclone season are starting. It gets worse in new crisis is added. Rose is a young organization, but we need to grow up as quickly as possible given the critical needs and denial of rights in the camp. Rose is primarily work with the refugees, but slowly reaching out to host communities. Similar issues are commonly shared by women, whether Rohingya or Bangladeshi. We are growing up as an organization because of the support of others. ADI is the very first who trusted us. There was no question of identity. They gave us the seed funding from Korean International Cooperation Agency, KOICA, for our successful psychosocial program and build our center in Camp 40. Still, we are running this project. Then there is Oxfam, who really had our hand. So as a young organization, we can work and learn life skills as we grow. Gender team in Oxfam really give me the confidence to be a professional leader. We developed about 7 policies with Oxfam monitoring, including gender and safeguarding safeguarding policy. Our staff enjoy internship experience. We get to sharpen project proposal skills. Through support from Oxfam New Zealand through MAP. Oxfam also connect us to other NGOs, to UNICEF, and most especially to UN Women and Gender and Humanitarian Action, WAG. We get to access funds from UN Women. The third actor I am thankful is UN Women. UN Women and the GHWG, which support gender mainstreaming across the entire response and provided us a platform for our advocacy to raise the voices and demand of Rohingya women and girls. UN Women also facilitated bridging our women leaders with many other women leaders in the different camps under a large umbrella women leader network, paving the way for solidarity and networking and to support their work through training and in-kind support. They allow us to use their facility in the camp. With Oxfam, we are part of a very empowering women transformative leadership project with the fund with the technical support of UN Women. Recently, we recipient of the Women, Peace and Humanitarian Fund, which will help us further support capacity strengthening of local Rohingya women's networks. All these are enabling roles to manage to soon build additional women's center, where we host healing space, trading shop, training facility, and support women address protection and participants in issues. Challenges. I like to focus on 2 things. First is about our legal status as an organization. Being a Rohingya and also a woman, I face a lot of barriers. Our current certification is from the joint stock, which only allow us to access national funds, not from a foreign country. It has been years that we are applying for the registration from the NGO Affairs Bureau of the government. We face numerous assessments. We overcome each step by providing every requirement they ask, even repeatedly. We cooperate with the government. We have to prove that my identity as the only Rohingya in Rose, and that Rose itself is not a race. The second challenge is deeply rooted on gender discrimination. The Bangladesh government offers law and policies that support gender equality. But this is not yet systematically translated to change in norms and practice on a day-to-day basis. The Rohingya culture is still very patriarchal. That's what we deal with. Being a woman leader myself, I face discrimination. We work on women leadership, which is extremely difficult when women are not even allowed to speak nor go out of their home. We overcome this by constant negotiation, provision of correct information, and even through discussion about the right interpretation of Islamic teaching about women. We must engage with male, especially male leaders. The third challenge is the continued lack of engagement, investment, and support to local women's rights organizations by the vast majority of humanitarian actors. Besides gender and women's rights, focused organizations like UN Women and Oxfam, most humanitarian organizations do not prioritize consulting, coordinating, partnering with the funding local women's rights organizations, despite this being a key way to support and be accountable to crisis-affected women and girls in the communities these actors serve. It is also a key commitment under the IASC gender policy and the Grand Bargain. I'd like to thank the organizers of this event for the opportunity to share our experience. I will share one quick. If we are to fight discrimination and injustice against women, we must start from the self, then home. If a woman cannot be safe in her own house, then she cannot be expected to feel safe anywhere. Gender equality is a big word. Rose is young, but we can do a lot more. We are a women's rights organization. We work with and are trusted by hundreds of women plus their families. We are supporting women to find their voice to speak, to lead. We need everyone's support so we can continue what we started. Thank you so much.
Razia, this was brilliant, truly an eye-opener at multiple levels. Personally, in terms of also specifically your role as a Rohingya women leader of this critical local NGO, although young, but it's also obvious that you're doing some excellent and critical work on the ground despite all odds and despite the deep-rooted issues around gender discrimination. I really appreciated what you said, which is the starting point is really the home and making sure that women feel safe and feel the level of equality for them to be able to speak up and ensure that the rights and the vulnerabilities of the of women and girls across the society are very well addressed. I very much appreciated also what you said, which is the big elephant in the room, is that local communities, women and girls, there's a very different level of trust that is attributed to local NGOs and colleagues of your nature, Razia, and they feel more comfortable and confident to share their concerns, very confidential and very sensitive issues that they feel more comfortable to share with you as a local leader than by sharing it with potentially an international actors. All of which points to, again, the critical recommendation or the call that you've made, which is a lot more needs to be done from the part of international actors on the ground to engage a lot more systematically and hear more your views and the views of your colleagues and other women leaders, and to ensure that the response is as gender sensitive as possible and very context specific. You've said a lot of great things, Razia, but I want to perhaps also turn to Joanne to also hear from her views and her experience in Lebanon. And I understand, again, the experience that she will be sharing with us is from her work with Syrian refugees in Lebanon. So maybe I'll turn again to you, Joanne, again, more practically. It's very, very important looking at the Rohingya experience in Kosovo, but also you've highlighted Myanmar. If I may ask again, colleagues, please put your phones on mute. Thank you. So that's one critical and important context. You have a very different picture also when you go to Lebanon and looking at the specific vulnerabilities of women and girls, Syrian women and girls in Lebanon. So maybe with that, we'll turn to you, Joanne, to get that picture of the specific needs of women and girls in Lebanon, especially in the Syrian refugees. And also, it would be great for you, Joanne, also to share some of the good practices or good examples around how gender is being prioritized, mainstreamed and implemented, and what are some of the challenges you're facing and how you are going about addressing them. So over to you, please, Joanne. Thank you.
Sure. Can you hear me first?
Loud and clear. Thank you.
Okay. I'm going to ask your support with this slide. So I'm going to ask you to move to the next slide, please. So here, I just want to give you a context overview on the situation in Lebanon, because Lebanon has been witnessing an economic crisis since September 2019, and the situation has been deteriorating since, which drove many people to join civil protests against the austerity measures imposed by the previous government. The economic situation has led to the devaluation of the Lebanese pound, which lost almost 80% of its value. And it heavily impacted the livelihood of different groups of the population, but mainly people living under the poverty line in Lebanon. Obviously, the situation was exacerbated by the outbreak of COVID-19 in March, and it impacted disproportionately women and girls, but more specifically the marginalized groups among them, which are refugee women and adolescent girls, migrant domestic workers, sex workers, trans, women and girls with disabilities, among definitely other groups of marginalized women and girls. I'm not going to go into details in the all the gendered impacts of COVID-19, but like this has happened in different places of the world where women and girls witnessed an increased load of unpaid domestic care and caretaking responsibilities, reduced access to livelihood opportunities, and an increased exposure to gender-based violence. However, what we're focusing on specifically is the major need that has been deprioritized during COVID-19, but it's not something new. It is generally deprioritized in outside of COVID-19, which is menstrual hygiene management of women and girls specifically. And why we're talking about this, because Oxfam Lebanon, since end of 2019, has been putting a lot of effort to mainstream gender into different programs in Lebanon, but mainly the WASH sector. And in order to do so, an MHM research has been conducted earlier this year to identify the challenges and the needs of women and girls in relation to MHM. And this has served as a baseline for a gender analysis that we conducted in June in last June, in order to adapt the findings of the MHM research to the context of COVID-19. Can we move to the next slide, please? So I'm actually going to also stress on some of the things that maybe April has said in her presentation, which is if we think generally in humanitarian response plans, generally, they often gender blind, although most of the sectors, and here we're talking about general sectors who do not have gender standalone programming necessarily, and who, although they are keen to reach 50% of women and girls, but in many cases, they do not take into account the specific needs of women and the barriers that women and girls face in relation to in accessing services. This is also reflected in the Lebanon's humanitarian crisis response, but if we also focus more on menstrual hygiene management, it has been largely deprioritized in favor of other basic needs that are also deemed to be life-saving. And there is a lack of clarity around which sector should take or should lead in the coordination of such a response. So yes, there are different, usually MHM falls typically under the WASH sector, but there are other sectors that are necessarily or should necessarily be involved, and these are the sectors that work directly with women and girls, maybe such as the education, youth, the health sector, SRHR, and so on. And so there's no consensus on on who is the ultimate leader or who bears the responsibility for addressing MHM needs. Can you move to the next slide, please? So during COVID-19, things are not very different. We need to know that during COVID-19, obviously, women and girls do not stop menstruating. We have also new adolescent girls who start menstruating during COVID-19. And so we know that MHM needs and challenges are exacerbated during any conflict or pandemic, including COVID-19. So based on the gender analysis that we conducted in Lebanon, one of the major needs of women and girls was accessing menstrual products. One of the main barriers for not accessing menstrual products is economic hardship. As I told you in the beginning, because of the devaluation of the Lebanese pound, the purchasing power of households decreased. And so automatically, women, like sanitary pads, are not considered as essentials, and so they're not prioritized in the expenditures of the households. So women and girls, according also to the NHM research, they opt for cheaper alternatives such as using nappies or pieces of clothes, or sometimes reusable pads. But in many cases, these options are not ideal from sometimes hygiene or comfort or medical perspective. And also, the needs assessment conducted by Plan International in April 2020 shows actually the same finding, that among the female caregivers who were part of the needs assessment, 53% of female caregivers do not have the financial means to buy menstrual pads on a monthly basis. Mainly among them, 63% are Syrian women. Other challenges, if we can move to the next slide, highlighted by women during the MHM research, but also during the gender analysis, is that women and girls are feeling uncomfortable changing their pads in mixed or shared latrines in tented settlements or inside their tent because of the presence of men in the settlement all the time. Especially since the government imposed the lockdown measures which limited the mobility of people in Lebanon. And finally, which is something that is common before and during the pandemic, is the limited access of women and girls to information related to menstruation. This is related to the culture of shamefulness around menstruation, the culture of taboo, where women do not necessarily request any information related to menstruation unless they are actually asked about the needs in information related to their bodies. However, still the top priority need during COVID-19, as per the gender analysis, is the access to menstrual products. Can we move to the next slide, please? And so if we really want to think about the things we could do, as like what the different sectors could do, I think there is a need to prioritize women and girls' needs under each sector. And specifically here, we're talking about menstrual hygiene management. And how can this be done? Definitely, if we're talking as a broader strategy, there is a need for clear gender mainstreaming strategies for each sector. If we focus a bit on MHM, there is a need for mainstreaming of MHM in relevant sectors. So that's why it's very important to adopt a cross-sectoral MHM response during COVID-19 that defines the scope of each key sector, including WASH, education, protection, CP, GBV, SRHR, and youth sectors. Second, and specifically during COVID-19, we need to prioritize distributing menstrual products to women and girls. And we need to take into consideration that women and girls with disabilities might have different needs. So one of the major things that Oxfam Lebanon has done is consult with women and girls with disability in order to design with them the MHM kits. And indeed, the MHM kit for women and girls with disability is slightly different. The items are slightly different from the other MHM kits, and it includes larger pads, it includes disposable bed linings, and so on. Another thing is that is very important is to ensure safe distributions, because in many cases, yes, women, the MHM products are distributed in disinfection kits or hygiene kits, depending on how each sector calls it. However, we need to make sure that women and girls do not feel comfortable receiving, they prefer receiving the kits themselves, and considering the challenges in distribution during COVID-19, household distributions are being conducted, and we are not able to do women-only distributions where we bring women together and share with them information and the kits. So it's very important to take this into consideration and make sure we're giving the kits directly to women and girls. Another thing that is very important is that while reusable pads are not women's preferred product as per the MHM research conducted in Lebanon, should those be the only available options, there are critical factors to be taken into consideration. One of the things, and it's one of the main recommendations of the IASC Gender Alert, is actually increasing quantities of water and salt distributed to women to be able not to only wash their hands, but to wash their pads. Because during the gender analysis, the main finding is that when water quantity was increased and was more soap was distributed, women were able to wash their reusable pads. One last thing, and I think it's already being done, but it's also very important to reinforce, if we can move to the next slide, please, is that WASH actors specifically should reinforce, not only WASH actors, but I think humanitarian actors should, in general, but this is focused for WASH, is how they could reinforce their participatory decision-making approach in designing latrines and deciding on their location, especially during COVID-19. Considering women have mentioned that they do not feel safe and comfortable using shared latrines, and this challenge has been reinforced during COVID-19. It's very important to include them in decision-making to see how we can adapt existing latrines according to their needs and concern. Also, according to following the recommendation of the MHM research, Oxfam Lebanon has started doing this through consulting with women's groups in the settlements about the designing the latrines, about their needs, and in order to accommodate and factor in these needs and concern in the renovation or the design of new latrines. Finally, and I think also it's very important to not only focus on gender vulnerabilities, but also focus on the support and the support that women provide to each other. If we can move to the second slide, I think we have a lot to learn from feminist solidarity in Lebanon. Since the beginning of the economic crisis, and especially during the lockdown, feminist solidarity has been crucial in fighting discrimination of marginalized groups of women and girls. This solidarity is led by women and is focused specifically on the needs of women and girls and the barriers they face in accessing support generally. One of the major examples that I'm showing you here is the example of Enya Lenya, which is one of the main Ethiopian domestic workers groups in Lebanon, led by domestic workers themselves, who mobilized money and funding in order to support migrant domestic workers groups affected by the crisis through cash assistance and distribution of food, including non-food items, also including menstrual products. And actually, this is also, we can see this type of solidarity also at the level of community-based groups in Syrian refugee camps led by women, where they do support each other in many cases before and during COVID-19, whether emotionally, whether they support each other in tasks they are required or they do on a daily basis. And so this goes back to the idea of the importance of including these women in decision-making processes related to response to COVID-19, but also in a more broader perspective in the humanitarian response plans on a national level, because these women are the ones who know best what their needs are and are the ones who can articulate best their needs and their concerns. And so we need, as humanitarian actors, to find ways to support and strengthen the existing solidarity networks that are often very informal. Last thing that I would like to show you also from Lebanon about the solidarity that came up during COVID-19, if we can move to the last slide, is, for example, this startup, it's a wellness and beauty startup called June, that decided to tailor their strategy or their objective during COVID-19 after they noticed that women and girls are unable to reach access menstrual products, and then they mobilized funds to distribute menstrual hygiene kits to underprivileged women and girls in Akkar, Tripoli, and Beirut. And this was their way to fight period poverty in Lebanon. And they are currently also planning to support women in designing their own path for the future. Thank you.
Many thanks, Joanne, for again a visual of the gender response, the nature of the gender response in Lebanon. And again, and I hear you loud and clear, and I think a lot of our participants would echo your call to ensure that more women and women networks are part of the decision-making process, as well as the design of response programs in the field, to make sure that we are as gender sensitive as possible in our response. I see a comment from Shikha in Nepal, who also said absolutely, but part and parcel of this is to ensure that we work hand in hand. I wouldn't go as far as saying building capacities, because I think building capacity goes on both sides. There are some expertise from the international community that can be helpful for local actors, but equally so, if not even more so, from local actors to international actors, that needs to also be passed on. There's a lot that we can learn, and there's definitely a lot more that can be done and should be done to ensure that we engage local actors and women, including women leaders and civil society in our and the way we conduct our needs assessment, and the way we program, and the way we also respond. I hear you also, Joanne, that there's a lot of good work and good efforts by various actors, including Oxfam and other colleagues, to mainstream gender in the response. However, there's still more to be done to ensure that we are less gender blind in our response. And you've made a lot of specific reference and a good example in terms of also how menstrual hygiene and management is conducted, and how even something as simple as access to MHM can be an issue of concern, and there are challenges in even making these products available to women and girls. Spoken about, again, the design of latrines and concerns across the board globally, but also maybe in specific cultures as well, concerns regarding sharing latrines, and how this is impacting not only their physical well-being, but also the mental and emotional well-being of affected women and girls. So again, a lot of great points shared by Joanne, and I can see also in the chat box a lot of good comments shared. I'm echoing April's call. Please, this is an opportunity really. If there are good examples, good practices, lessons learned from the field, please do share them in the chat box. We're all looking at the comments as they come in. And maybe also, just before I go to the questions that have come in, I think this has come out a number of times by panelists. One of which is, of course, although gender equality and addressing the vulnerabilities of women and girls is a cross-cutting issue. It's not specific to one sector, but I also hear Joanne's point that there is a need to ensure that we do more, whether it's in terms of developing specific strategies or plan per sector, to ensure that gender issues are not lost in translation, or that they do not fall between the cracks. So that's one proposal in which we can go about that. But I've also heard across the board that despite serious concerns around gender issues, gender inequalities, addressing gender vulnerabilities, funding remains a critical problem to enable actors, local and international, to do more in this space. So this is a call out also for colleagues and donors that may be online to seek their support in this space as well. So maybe just jumping to the questions, there is a question that has come in. Perhaps I will address it to you, April, and it comes from Harriet. What are some of the specific actions we can do beyond advocacy to address the already glaring impact of COVID-19 on women and girls? So perhaps, April, maybe I can address this question to you, and of course other panelists are welcome to come in and augment or complement the responses from April. But I also ask participants, again, this is meant to be an interactive session, and there's a lot that we can learn from participants online as well. So what are some of the specific actions we can do beyond advocacy to address the already glaring impact of COVID-19 on women and girls? And Joanne also alluded to some of these practical measures or examples, and so has Razia. And maybe for the second question, I'll address it first to Razia. The question is as follows. It's from Dell. How is the agency taking into account or taking into consideration girls and women with disabilities? So how in your response to the need on the ground paying particular attention and adapting the response to meet the very specific needs of women and girls with disabilities? Maybe we'll start with two questions and then we have a mini round. Colleagues, once again, please, if you're not speaking, I would ask you to put your phone on mute. And maybe over to you first, please, April, if that's okay with you.
Thank you. And certainly here I want to take the opportunity to invite Julie to come in on this because we've been talking about some of the really practical ways in which some of our other Oxfam colleagues are implementing in some of the operations. So I really want to take the opportunity to really share from the field experience right now. Julie, if you want to come in on this.
Yeah, hi everyone. I posted some examples in the chat at one point, but some of the really practical things that sort of come to mind for me. One of the things that Oxfam was able to do quite early on in the response was to take some small funding, very small, like maybe 10,000 euros, for example, and reshift that directly to partners and to some of our country teams on the ground to address, for example, what we were hearing in terms of the need for information, the need for shifting GBV services, for example, increasing hotlines, providing small money that would allow to staff the hotlines for a longer period of time, for example. So being able to shift some money very quickly, I think did have quite an impact in some of our country for some of the partners that we were working with. But other things as well, just information really is power. I was really struck by what Razia was saying around how women are being blamed in some of the camps for spreading, and how important it is to address some of these issues and to have timely, accurate information. I think that is really important to do. You can only do so much with the information that you have, and if you don't know and no one's there to counterbalance that. So there's something around that. And then, it depends. The practicality, for me, depends a lot on what your specific sector is that you're working on. So if you're doing food distributions, can you integrate some of that information component? Can you make sure that you have water stations so that you can wash your hands, you can distribute masks? What kind of PPE support do you have that you can share with the community so that they understand and then they're more empowered? And then one of the things we've seen throughout this response is the reshifting of funding that was going to preventing, for example, FGM or early child marriage, and the importance of not shifting that, not stopping those programs and those activities, because I think what's come through this webinar quite clearly is the fact that the issues were there before. The issues we're facing now were there before. They're just being exacerbated. And if we stop funding those preventive projects and those activities, then we're gonna lose track. We're gonna take some steps back. So I think that might seem like you're not addressing COVID, but you are addressing the needs of women and girls. I'll stop here. I did see there was an interesting example, also a practical example from, I think it was VSO in Nepal, who are adapting some of their programming for hearing impaired girls. I don't know if someone from VSO Nepal wants to come in and speak. I did notice that one. And I don't know if there's other partners who would like to to contribute to this? I'm sure there's a lot of examples.
Great, thank you. Thank you, Julie. Thank you, Joanne. Thank you, Joanne. Absolutely, I'm seeing also the chat box is getting, quite busy, and I see from Kawinzi, many thanks, Kawinzi. Here she's saying where dignity kits are not prioritized due to limited resources, we have found that working UNPA, we can give a family, girls and women, CBTs, 2 wallets, one for food and the other for dignity kits. Just a practical example that may support, again, as a good example for colleagues in the field in terms of addressing the need for dignity kits. Razia, is it okay if I turn to you, Razia, in terms of, again, the specific needs of women and girls with disabilities? Are there any practical examples that you can share with us in terms of how you are addressing these very specific needs?
Thank you for the question. Yes, when we start our program, we give the priority about the disability, because when we choose the woman, the first thing we train them how you can help the disabled woman, if you woman or girls or any man in your family. So we train them, and specifically we are special caring, because I work in the camp 14. And there is some people who have disabled children, also the women, even after the stroke, some are paralyzed at home. So this is very critical moment for them in dense area, and this is very narrow, narrow area, small shelter. You cannot provide what you need, but what we can among among this situation, we give some advice, and some also helping, sharing helping hand, and some also I want to share. There are some family who have no helping hand, so we train our volunteer to help them about the taking in the hospital, taking about the food ration, when you have to collect your own food by yourself. So in this means we help our volunteer help them to carry, and it's a very sensitive issue. But I saw that there are so many NGOs there giving very positive support to them, and also we have tried to give our best. And one thing we have to focus when we plan any program, we have to keep this group as a vulnerable community. So you have to include in your project, and you have to divide the budget for them, because these people need some special thing. So sometimes we are lack of fund. We cannot support directly, maybe for helping with practically, but some also need about the wheelchair, and some also need the expensive medicine. In this case, I want to suggest the INGs, they have to look about this situation. Thank you so much.
Thank you, Razia. Very much appreciated. And perhaps I will turn to Joanne next. But again, asking colleagues to please put your phones on mute when you're not speaking to minimize the background noise. So the question for you, back to you, Joanne, is this is from Atiqa, what alternates can be used by women for communication during pandemic, as most of refugee women do not have any facilities to make contact or to have contact with support services. So what alternatives can be used by women for communication during the pandemic period, as most refugee women do not have facilities to stay connected or to make connection with support services. So this is perhaps to Joanne, but before you come in with a response, I just want to alert colleagues to also a point by Anu Pillai with regards to the funding issue targeting women-led organizations. So he's saying that the Feminist Humanitarian Network has raised funding to support women's organizations working on the ground to address the impact of COVID. So maybe just something to alert some of the colleagues online, especially civil society organizations and women-led organizations, also taking a look at the Feminist Humanitarian Network as an option to channel funding to support you during the current response. So over to you, Joanne, perhaps with this question on communication.
Yeah, I think one of the major challenges during COVID-19 is access of women and girls to information in general. And so, yes, refugee women have less access to communications, to phone, to internet. And in order to understand how we could reach them, we actually conducted a survey to try to understand how we could reach the most marginalized groups, because among women, there are groups who are more invisible than others, as, for example, pregnant women, adolescent girls, women and girls with disabilities. And so we were interested to understand how we could access these women and how we could allow space for them to access information in general. And so accordingly, women shared with us. So I think the most important thing is to ask women what is the best modality of communication, because accordingly we could tailor our strategies. So, for example, during COVID-19, and considering the limited mobility for everyone, we were not able to access the settlements. So our women focal points who have been working with Oxfam since before COVID-19 were the ones who were sharing information with community members around services and awareness on COVID-19. Also, when the lockdown measures started to become more flexible, and when we asked women about the best way to actually share information, they specified that now the best way would be, for example, to conduct awareness sessions in smaller groups while respecting social distancing. I think here it has to do with the context and limitations in each country, but I think the key thing to do is ask women. If we're unable to reach women directly, it's important to ask women volunteers in the community to ask women about the best communication modalities. Hello.
Thank you, Joanne. Thank you, Joanne. Just reading here quite also an alarming account from Musumi, noting that there's a very limited scope to get shelter services for women in general. And this lockdown situation, women have very limited scope to get legal assistance through helpline. It is a real crisis, and women have to stay at home with due to their economic vulnerabilities without getting proper service. Again, I will perhaps turn back again to Razia if there are any specific, examples, or colleagues online, if you can share specific examples in terms of how we can support women, again, especially during this lockdown period, especially experiencing gender-based violence and challenges in access to legal support or helpline. What are some of the creative solutions or means by which we can make sure that we are able to reach and support women during this very critical period? I will come back to you again, Joanne, on a question that was posed by one of the colleagues online, specifically on what are the reasons why women and girls were not so interested in reusable solutions. But I'll come to you, Joanne, in a minute to respond to this question. But before you do come in, as well as Razia, on the GBV issue and access to legal assistance and hotlines, I'll turn to April, perhaps April and Julie, because the question is still coming back again with regard to possible practical and workable steps to mainstream gender and prioritize GBV mainstreaming across the different sectors as part of, the UN and NGO response. Any practical solutions that you can share with colleagues, and perhaps that can also form part of your closing remarks, because I know we're coming up on the hour 15 minutes. So over to you first, April and Julie, to respond to this question, and then your closing remark, and then we'll turn to Razia on also some ideas with regard to how do we deal with GBEV issues, particularly with women that are on lockdown and are not able to access legal assistance or hotline support. And then concluding with Joanne on the issue of reusable solutions, and also if you can use the opportunity to also deliver your closing thoughts and remarks, that would be brilliant. So first to you, April and Julie.
Thank you. What a rich conversation already. But let me just talk to this issue of how do we mainstream GBV. I think the GBV community, and in particular the GBV area of responsibility, together with all of the GBV coordinators, led by UNFPA and many of the INGOs that are on call today, have been quite proactive in terms of showcasing the prevalence and the risk of GBV during COVID with all the quarantines. And that certainly really worked in all of the operations to make sure that those issues are A, prioritized, and that B, the risks are identified and minimized. And that 3, we also continue to advocate and lobby for funding to make sure that local organizations, and in particular women's organizations who are responding, have the resources to mobilize community advocates, community volunteers, to ensure that there is that support to women and girls, especially when safe spaces are no longer available, especially when access to hotlines are not available, etc. So from a GBV mainstreaming perspective, there's been quite a lot of work, and I really invite you to go to the GBV AOR website. I will put that up in the chat in a moment. Because they've been conducting weekly and I think now monthly webinars on GBV mitigation and how partners, including the UN, including local organizations, can mainstream these issues into their various sectors. So it's not just about GBV people working on GBV issues, but it's about how do we identify the issues in food security sector, for example, that puts women and girls at further risk. You know, how do the WFPs, how do all of those who work in food distribution and livelihoods, recognize these issues and program it into the way that, that they do their work so that we can mitigate some of these. So I want to really invite you to really look at, some of that work. And in particular, the GBV minimum standards that have been issued by UNFPA, that really gives us, some practical elements on how do we start mainstreaming some of this. While I have the floor, I also want to just address the issue of PSEA, the protection against sexual exploitation and abuse. I think Amit had raised this issue. And it's really important that when we talk about broadly gender equality and how we do gender equality programming, that we think about the mitigation of GBV, including the mitigation of risk to sexual exploitation and abuse, because all of this is to do with the structural dynamics, the structural inequalities that that are so pervasive that put women and girls, women and children, and those who are from marginalized groups, including women and girls with disabilities, at further risk. So I think it's important that we package all of this holistically so that we're not dealing with these issues in isolation, but it is all part of the broader agenda of gender equality. So maybe I'll end there, and then if Julie would like to also come in on some of these points.
Yes, thank you. Just a couple of things. I guess for me, the question around gender mainstreaming, and it applies for GBV mainstreaming, mitigating risk of GBV, but it has to, the thinking about it has to come at the beginning. At the beginning of the discussions around what our programs and what our activities are going to be. And those discussions have to include consultations with women and girls. And if they don't, then we're going to miss the boat. we have to get it right. We have to start from the beginning to engage on these issues. And too often in humanitarian responses, we don't. We set up programs, we set up our activities, then after we think, oh, what about gender mainstreaming? That's not how it works, and that's not how we're going to improve. We have to think about it from the start. And a part of that is how we're going to fund those activities. What types of changes, small amounts of money do we need to be able to consult women and girls, to be able to provide childcare support for the women to be able to come and do the consultations, for the women to be able to engage in cash for work or voucher work activities. If you don't have those additional components in your in your proposals around supporting the women with childcare, with water, you know, if they have to walk 2 miles to get water every day, how are they going to engage in work? So engaging the gender colleagues from the start will already have a huge impact, I think, on programming, on GBV risk mitigation, on gender mainstreaming, and also will allow you, therefore, more time to think about gender-targeted action, which you also need in your programming to make any kind of shift on gender equality. So I was going to leave that there. Thank you.
Thank you, Julie, and thank you, April. And maybe swiftly we can move to Razia, and we'll conclude with Joanne, please. Over to you, Razia, please.
And the Cox's Bazar camp and other countries' camp is very different, very, very different, because the Cox's Bazar camp is very, very congested, and those who are visit the camp, they understand actually what is this. So about the gender analyzed, gender GBV, and the violence, what is happening in this camp, you cannot on the spot recognize, or you can stop this one. You have to be very carefully see this situation, why and how and where it is, and by whom. You have to see very very carefully, because it is very conservative community. And sometime about the violence, what about is against the children, also against the women, also the girls. When we ask anything, they cannot allow us to talk about this kind of question or this kind of counseling. So I think we have to improve the programming, how we convince understanding what is the GBV and what is the affected by in their society and their family. So from beginning, you mentioned about the hotline. Who will use this, and how can they use this? Because the Cox's Bazar, the communication is very tough. You can, if you want any news, you have to use the man-to-man. You cannot use the phone because of the low connection. Forget about the internet, but about the mobile connection. And about the mobile is not in, especially the mobile use only the male. Few women, they are allowed to use this. So hotline service is not workable in the camp, especially in the Cox's Bazar camp. So we have to change the method, and we have to create some new new program. So how can we practice this exercise for this community? So how can we prevent the GBV in the men, women, and children? Thank you so much.
Thank you, Razia. And again, the underlying point there is, again, being very context specific. In some contexts in the world where mobile phones are very much available to all communities, including also in the affected communities that we're there to serve, but in other communities and in other contexts or in other parts of the world, that is not the case. And we have to go back to basics in terms of word-to-word communication, ensuring that we are able to, locate and identify women or girls that are being affected due to by GBV, and ensure that our responses are very targeted to the very specific context that we operate in across the globe. Maybe with that, I'll turn to you, Joanne, also with your final thoughts, please.
Yeah, first to answer the question on reusable pads and why women and girls in the research, MHM research, have expressed that they do not feel comfortable using reusable pads, and that for many reasons. Because first, the reusable pads need a lot of water to wash them. And so before COVID-19, these quantities of water required to wash them were not available. And soap distributed in kits also was not enough to continue washing them. So when there's more risk in using a dirty reusable pads than actually using pads, generally reusable pads. And so it's very important here. That's why I go back to the importance of tailoring strategies that we have under the WASH sectors to the needs around MHM. That's one. Another reason why they don't feel comfortable is that also it's a question of comfort. They said they don't feel comfortable wearing them while they're doing their caretaking and domestic chores, or while working in agriculture. So it's also a question of comfort. So that's why they generally prefer using disposable pads, and that's why the main recommendation, especially during COVID-19, is to distribute disposable pads. And one thing that I just remembered from the MHM research is actually they don't feel comfortable washing their reusable pads in the settlement. They don't feel there's a lot of shame around menstruation, so washing the reusable pads in the settlement is not very comfortable. Also, drying them while everyone was going to see that the reusable pads are being dried does not put women and girls in a comfortable position, and that's why they prefer not using them. And yeah, that's the question around reusable pads. I just want to add like a concluding note, just to complement what everyone has said before, is that yes, it is very important to do gender mainstreaming, and it's very important to adopt a more intersectional approach while doing gender mainstreaming, because we are aware that not all women and girls are affected in the same way from COVID-19 and from conflicts in general. So it's very important to identify who are the marginalized groups who are not able to access services and information, and to adapt our strategies to reach these specific groups, because they are the ones who are at the margins. And so it's good to look at this and to see also in parallel of gender mainstreaming how gender standalone programming maybe could support in reinforcing gender transformative approaches, because it's not only about allowing space for women and girls to creating space for women and girls to access services, but also it's to challenge gender norms and structures for women and girls also to feel comfortable accessing services and information without any barrier imposed from because of gender norms and structures.
Excellent. Thank you, Joanne, and really a huge thanks to all of our panelists, and equally as well, all of our participants. Thank you for making it a rich discussion. Thank you for the great questions, and also the advice and the sharing of practical lessons learned, best practices from different contexts. This is really, really very helpful, and it's exactly what we're hoping with this webinar. I think it's also very clear, again, from the examples that Joanne and Razi have shared, that the needs of women and girls on the ground are very specific to the context, not only to the country, but to the specific communities, to the different settings that they live in. So it's really, really very important, again, not only to, of course, there's no blanket solution to the responses, but there's a need to ensure that our responses are very, very context specific, and they can only be context specific the more we create more space and enable women in the communities and women leaders to have a seat at the table. And also, even if the culture does not encourage them to speak, but creating a safe space where they feel comfortable and confident to share and raise their voices and share important information to make sure that the response is as specific and as relevant as possible. I think one thing that also came clear is that there is more, although there has been a lot of progress on the issue of addressing gender vulnerabilities and empowerment of women and girls over the years, there's more definitely that can be done to close the gap between the policies, the guidelines, and the commitments made at the global level to doing more on the ground to further mainstream and gender issues and ensure that we address the very specific nature of gender vulnerabilities on the ground. Funding is a key issue, so this is a key message that came out very clearly from all of the panelists as well as the comments online. And maybe with that, and I know, thank you, April, for addressing the issue on PSA, SHA. These are all, as well as mental health and psychosocial support is another aspect, as well as the issue of disabilities, all of which are intertwined. And that's why we can never say it enough that gender is a cross-cutting issue, and it's critical for it to be done hand in hand with other critical cross-cutting issues, such as PSA, SHA, protection, and other critical areas of work. Please do visit the IASC website. We've made an effort to ensure that the page for this briefing, there's all the material that may be useful for you uploaded on that page. The information or the details of the website is on the screen. And maybe just to remind colleagues that we do have an IASC peer-to-peer webinar organized on the 15th of July at 3 p.m. Geneva time on the light guidance on collective outcomes that was just endorsed by the IASC principles. So we will have a number of brilliant also panelists joining us then, including Dr. Dani Sekandarajah, who's the Chief Executive of Oxfam in the UK, as well as also Mr. Raouf Mazou, who's the Assistant High Commissioner for Refugees in charge of operations in UNHCR, and a number of other panelists that we're confirming as we speak. Once again, thank you, colleagues, so much for making the time today, and thank you for the very good and rich discussion and the great examples and lessons that you have shared with us during the course of this webinar. Many, many thanks. Have a great day, everyone.